Hello, and thank you for joining us for this discussion on healthcare on a budget. This is the third webisode in a series of 4 that's being sponsored by Mission Healthy Living on living healthy on a budget. I'd like to introduce my guests. Joining me today are Dr. Keith Harrison, and Dr. Harrison is a family physician with the Bally Medical Group, which is part of the Pottstown Medical Specialists for Primary Care. Welcome, Dr. Harrison.
Hello.
And Paula Camp, who is the Community Outreach Director for Community Health and Dental Care.
Hello.
Paula, oftentimes when somebody is concerned about their budget and trying to make ends meet, they may have to cut back on things that they shouldn't. And unfortunately, going to the doctor or dentist can sometimes be last on that list. Are there any affordable healthcare options available to the greater Pottstown area for those residents who may be underinsured or not insured at all?
Fortunately, Marcia, for the people that are currently uninsured or underinsured, medical care is accessible and affordable. Community Health and Dental Care, located at 11 Robinson Street, Pottstown, is able to provide low-cost health care and dental care for those with or without insurance. A health care discount is offered, and this is based on a patient's income and the federal poverty schedule. This makes primary medical and dental care accessible and truly affordable.
So it's like on a sliding scale.
Exactly.
Okay.
For those patients that qualify, the minimum payment for medical services would be $20 and $40 for dental care.
Is that per person or per family?
It's per person.
Okay.
The sliding scale is based on number of people in your family.
Okay.
However, there is a dental program currently offered by Montgomery County. It is a grant that covers dental expenses for those aged 21 and younger without dental insurance. They must meet income requirements, and they also must live in Montgomery County. And we do have a wonderful patient financial service department that would be able to walk the patients through these steps in order to receive this discount.
Okay.
We also have a case manager and a referral assistant, and they are there to ensure that everyone has access to medical and dental care.
How does somebody go about, do they just walk into your office? Should they call you?
If someone is in need of medical or dental care, the first step is to call our friendly staff.
Okay.
To make an appointment. For medical appointments, you may dial 610-326-9460. And for our dental office, it's 610-326-7405. Let us know your situation, and we will go through all of the options for you. And of course, we do accept Medicaid, Medicare, and most other insurances, private insurances as well. We do also have staff that speak fluent Spanish, so this would alleviate any language barriers that could exist. And first and foremost, Community Health and Dental Care is here to care for the community by providing quality medical and dental care for the entire family, regardless of your insurance status.
That's really, really very great, Paula. What is your range of service? Like, is it just in the Pottstown area? How far out do you service?
We will service anybody who wants to. We will provide service to anybody who wants to come to our facility.
Okay.
Basically, it's a 10, 20-mile radius currently right now, but we will service anybody who is willing to drive to Pottstown.
Okay. All right. Well, that's great. What about on a larger scale? Are there any state or federal programs for someone who's on unemployment or low income that can help them with health care or their insurance?
Resources are really limited.
Yeah.
But the free clinics that are available, they do not provide a patient-centered medical home. So the best option for somebody who is unemployed or with limited income would be to visit a community health center like Community Health and Dental Care in Pottstown.
Okay.
And this way they would receive optimal care. The health care discount that I just spoke about, it does apply for those who are unemployed since it is based on your income.
Okay.
There are some agencies that provide assistance, such as the Department of Public Welfare, Centers for Medicare and Medicaid Services, and the Pennsylvania Department of Health. For those that are interested also in learning more about community health centers, you can visit PAC's website, and that's the Pennsylvania Association for Community Health Centers, or on a broader scale would be NAC, which is the National Association. We do urge anyone that feels they cannot afford health care or dental care to contact us. Community health and dental care is welcoming new patients daily, with or without insurance. Our extended weekday and Saturday hours do make getting medical and dental care convenient, and that's even for those who do not live in the Pottstown area.
What a wonderful community resource.
Thank you.
It's wonderful. And for the viewers, we will show those websites at the end of this webisode in case you didn't catch them when Paula was talking about them. Dr. Harrison, I guess the key thing is to not get sick in the first place. Nobody wants to spend money, especially when you're on a budget, spending money on over-the-counter or even at affordable rates. The key is not to get sick at all, but that's not always going to happen. So what are some ways that people can look at their habits, look at their lifestyle and say, these are ways that I can maybe prevent my children, my family from getting sick in the first place?
Absolutely, Marcia. You know, there are 5 easy things that if we all adopt these 5 steps, we'll be healthier. The first thing, we have to eat properly. Second thing would be make sure you get plenty of exercise. The third thing would be make sure you're getting enough sleep. Don't smoke, and limit your alcohol intake. So when I'm talking about eating right, we should all, eat more fruits and vegetables, lean meats, more poultry, fish. The American Heart Association recommends that we consume at least 2 servings per week of oily fish such as salmon, mackerel, or trout. And that way you're going to ingest the needed omega-3 fatty acids, which are necessary for cardiac health. In terms of exercise, unfortunately, most Americans aren't getting enough exercise. The current guidelines recommend 150 minutes per week of moderate intensity exercise. So what you're talking about is 2.5 hours per week of moderate intensity exercise, such as a brisk walk. If you do a mile in 15 to 20 minutes, that would be considered moderate intensity. So most people would break that up into 5 days a week doing 30-minute stints, and then the other 2 days per week if you engage in some sort of resistance training such as weightlifting. That helps to maintain muscle tone, improve balance, and that's been shown to prevent falls. In terms of our sleep hygiene, most adults should be getting about 6 to 8 hours per night. Most adults are not getting 6 to 8 hours per night.
It's hard sometimes when you have families and kids and all of that. That can be very difficult. Do you recommend a nap if you can? It's even more of a luxury.
Yeah, well, and actually, if you find that you need a nap, that's an indication that you're not getting enough sleep during the night. So adults should strive to get 6 to 8 hours per night. Children and adolescents, 8 to 10 hours per night. And if you're not getting enough sleep, that can hinder your ability to lose weight. It can also affect your blood pressure and obviously your mental and cognitive abilities. In terms of, everyone knows you shouldn't smoke. It's linked to many chronic disease, heart disease, stroke, high blood pressure, cancer, chronic lung disease.
And it's a way to save money.
Absolutely. A pack of cigarettes are what, about $6
I have no idea,
per pack.
But I know I've driven by convenience stores and I look at how much a pack of cigarettes is, and I'm like astounded.
Correct.
So.
And then limit your alcohol intake. Men should consume no more than 2 drinks per day, and women no more than 1 drink per day. So if we all adopted those 5 easy things, eating right, exercise, plenty of sleep, not smoking, and limiting our alcohol, the population would be a lot healthier.
A lot healthier. And
then our healthcare costs would go down because we would not be utilizing the healthcare system. Some of the other things that you can do, the current recommendations are that anyone 6 months of age or older should receive a flu vaccine. And there are facilities where if you're on a limited income, you can receive a free flu vaccine. I know Montgomery County Health Department offers various times, various flu clinics where you can walk in and receive a vaccine. And then, of course, proper hygiene, hand washing, You know, that's been shown to reduce the transmission of infectious disease.
Even that gel stuff.
Even the gel stuff, yeah.
Great.
So frequent hand washing will keep you healthy.
All right, great. Thank you both. To view this webisode and all the other webisodes in the series, please go to www.missionhealthyliving.org.